I'm Rick Buck and I've been a dentist for 14 years. I like to cover all things oral health related, including dental product reviews. So subscribe if you have teeth and care about your health. In this video, I will show you the best way to floss, including when you should floss. First, I need to show you what to look for, and to do so, I will stain the plaque in my teeth pink, as I always do. There are two areas or spots that you want the floss to clean. The first spot you want the floss to clean is the direct spot where each of the two teeth contact each other. This is the most common area between the teeth where you will get cavities. Any floss, no matter how good or bad you floss, will clean this area likely, as long as it snaps through the two teeth. The second area that you want the floss to clean is at and below the gum line in between your teeth. Now, to most people, you may think they're the same spot, but they're not. This spot will still get cavities, but not as common as the first area. But that doesn't mean this spot is less important. In fact, you see, this is the main spot where gum disease and gingivitis starts. And long term, this is the spot that, in my opinion, is more important to keep healthy for your gums and overall health of your body. Both are important to clean, but in my opinion, the second is slightly more important, and it's especially more important to be thorough in that area. Okay, now that I'm flossing with my plaque stain, you can see the plaque move with the floss. So to move the plaque like this with the floss, it's good to know how to get a secure hold on it. Quickly, let me show you how to securely hold the floss to get a great grip so you can floss efficiently. Hold the floss in one hand with the thumb and the pinky. Wrap the floss around the bottom two fingers with the floss going down the back side of the fingers and then up the palm side. It might take a little practice, but as soon as you get it, it will happen fast. You wrap it 2 or 3 times around those two fingers, and then you let your thumb go. Once you loosen that side, you now hold the middle of the floss with the thumb and the index finger. So it's wrapped around your two bottom fingers and held by your index and thumb finger. Then you do the same thing with the other side of the floss on the other hand. Now, if you pull it tight, you should be able to push tightly with the two thumbs, and it will be tight against your fingers that it's wrapped around. You will use mostly the thumbs for flossing the upper teeth. Then you can also switch to press down with the index fingers, and you will do this mostly for the lower teeth, and it will stay secure, still wrapped around your two bottom fingers. So once again, it's the thumbs that you use to floss the upper teeth and the index fingers mostly that will floss the lower teeth. Sometimes I will use the middle finger, and especially for this demonstration purposes. Now, to floss the left side of the mouth, the fingers on the right hand you position on the inside of the teeth near the tongue, and then the other hand on the cheek side of the teeth. So for example, if you're flossing the top left teeth, it will be the right thumb. If it's the left bottom teeth, it will be the right index finger that's on the inside of your teeth. And once again, when flossing the left side, it's the left hand that will hold the floss on the cheek side of the tooth. Then when you floss the right side of your mouth, it is the opposite. So you use the left thumb or index finger on the inside of the teeth, and then the right thumb or index finger on the outside holding the floss. As always, once again, we go back to my plaque that I stained before I flossed. Now, in my opinion, it is best to floss before you brush. If you want to see why, watch my video about the sequence of flossing and brushing that I will post at the end of this video, or watch my best daily brushing and flossing routine. The main reason is actually the floss does all the heavy lifting of the plaque in between the teeth, not the brush. The brush mostly just does the detailed work and brushing away of what the floss dislodged. Now, you don't want to just snap the floss between the teeth. Although, like I said earlier, that is half the battle. But you can see, as I am doing here, that you want to make sure the floss goes below the gum line and wraps around the tooth as much as possible. Then you do little pull-up movements that dislodge most of the plaque without pulling and snapping the floss out from between the teeth yet. Then you do the same thing on the tooth in the front of the gap and pulling the floss forward. This time, when you do the pulling up movements, you can snap the floss all the way through. Now, most of the time, this will dislodge a heavy majority of the bacterial colony all at once since you haven't broken up that biofilm by brushing first. So the floss will just kind of move all that plaque biofilm as one unit. Now, once you've done this, then you simply just need to do this for each gap in your tooth. Now, what I'm doing here is taking a while for demonstration purposes, but once you get the hang of it, it should go pretty quickly. So now that you know the technique, I will tell you what to look for in the floss itself. I have linked to this, my favorite floss and brush, in the description with a $30 off if you use that link, because this is the best floss for a few reasons. You see, this floss narrows, expands, and flattens. You want the floss to narrow when you pull it tight to get it to snap through the teeth, but then once between the teeth, it slightly expands to get a little bit better in the concavities you have between your teeth. And then you want it to flatten to increase the surface area as it cleans while you slide it against your tooth. So if you watch all my dental floss reviews, you'll note that not all flosses do this. And all flosses are pretty good, but this one is just far above the rest. So I would make sure you get that floss from the link below this video. And as you see, it easily dislodges the biofilm as a whole most of the time. Now, it may not pull it out, and then you can just brush that away with the brush, but dislodging it is what is most important. Now, we pause to look at the final result of the flossing after I rinse. Now that we've covered the grip, the technique, and the type of floss, let's cover when to floss. It is important to floss at least once every 24 hours. Why? It takes 24 hours for bacteria on your teeth to start the decay process. Normally it takes at least 6 months before you get a full-on cavity that's noticeable in x-rays, but the process only takes 24 hours to possibly start. And you don't ever want the process to start, because then the rest of the process becomes so much easier for the decay and the bacteria to progress. So if you constantly are disrupting the bacteria every 24 hours, it is very likely that you will not get a cavity. It's that simple. But twice a day is best, once a day at least. But now let's continue with the brushing with my favorite brush. And the brush I use is really good, so keep that in mind as you see the results. But the results are amazing. I am stunned. You can see it is almost spotless. It is even really hard to tell that there was even stained plaque here to begin with. This is why I highly recommend the floss and the technique that I use. So remember, floss, then brush, snap the floss through, and then slide the tooth on the front and the back of the teeth of each gap, and then snap the floss back out. Do this once every 24 hours. Get great floss and a toothbrush. My recommended floss and brush are in the YouTube description below. Subscribe and watch my best daily brushing and flossing technique now.